primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Well, welcome everyone. I am so excited to be joined by two special guests today. So let me go straight to introductions. I will first introduce Zach Holdsworth. You've heard from him on the podcast before, but Zach is the CEO and co-founder of Hint Health, for those of you who don't know. Hint is the leading tech company focused on the growth and success of the direct primary care movement. He is also joined today by Dr. Janine Rodoms, a fellow family physician who has been in practice for over 2 decades in Santa Cruz, California. And she is a fierce advocate for DPC. So welcome, Zach and Janine.
Thanks for having us.
Thank you.
So this episode is really focusing in on DPC going into the future. We are at such a pivotal point in healthcare in this country, especially with patients, physicians, and everybody who's involved in healthcare wanting and demanding change. So appropriately, this year is celebrating Hint's 8th year hosting Hint Summit. And this year, the title is appropriately Elevating Healthcare, DPC's Climb to Mainstream. So with that, I want to get into what does it mean for DPC to go into the mainstream. One thing I want to point out here is that Zach, Janine, and I, and Sydney, who's not on the call, of Michi Health, we're all on a team lobbying in DC early in the spring. And for me, it was clear as we were going around to the different staffers' offices and the different senators and representatives' offices that stories matter. So can you each speak to what does it mean to you to think about DPC going into the mainstream, and how do we harness the power of stories to help the DPC movement go forward?
Yeah. So I think historically, DPC has been a physician-led grounds-up movement. There's been a lot of push that's needed to happen to kind of get that flywheel effect going. And my view is that what we're starting to see, and that's something that's super exciting, is that we're starting to see it become more of a pull, right? When we're on the hill with the two of you, I actually was like playing more of a supporting role. I said, I'm like the bodyguard, right? But the thing, there was one staffer, I can't remember who he was, but I remember one of you told a story, and you could see he kind of on the front end, he's like, I don't really have time for this, but I have to do this. Halfway through, there was a moment where it clicked for him, and you could actually see his posture change. He actually leant in, and then he actually went and got another guy, brought another one out, right? And so it was just like that, a very stark difference. And I think it was as a result of the stories you're telling about the care you're delivering to patients, right? Like that was the moment, right? DPC is becoming the stories of success, the success stories with DPC, both in terms of patient success, right? Really just awesome stories from patients who spread the word of the amazing experience they're getting. The kind of stories from physicians who are saying, hey, listen, I've really transformed my life. I've really transformed the love of medicine, right? Encouraging other physicians to go in as well, just follow this movement. But also importantly, we're starting to see kind of the narrative on the employer or an advisor or broker side of things as well, where folks are saying, instead of having to educate the market on like, what is this new thing? It's off to the side. What we're starting to see is actually that's turning into a kind of more of a pull where people actually come in seeking out DPC. And that's really something that I've observed quite a lot actually in the last few years. Actually, one example will be is I would often be not invited to speak at conferences but now actually what's happening is people are saying, hey, can you come and speak on this topic? It's a small story, but something that is, I thought it was really interesting as well.
This is so a full scope moment right here, Zach, when you are talking, because I didn't even know what DPC was in 2019. And it's because of Janine sitting down with me at a table for an hour and a half, explaining to me what DPC was. And I was sitting there overwhelmed, but totally transformed in terms of I didn't even know that this is a possibility. She said to me, in a month is going to be Hint Summit. And that was my first summit back in 2019 in San Francisco. So it's so awesome to be talking with you both and talking about the importance of stories, because stories are definitely proven to make change. So, Janine, what does it mean for you to see DPC going into the mainstream? And how do we continue to help the movement with our stories, especially given that you have been in DPC for quite some time, almost 10 years now?
Right. We've been doing our model. We're in our 9th year right now. And we're at a point where we're seeing that the community has finally recognized that what we are doing is so much better than what is available in medicine right now in terms of the continuity of care and the help and the value and the relationships and the trust that that continuity generates in our model of care. I think it's fascinating to see that our stories collectively are beginning to encourage other docs to say, hey, is this not something maybe I can do? And we are seeing those stories, and people are even coming to us to look at what we've been doing to help assist them to open these practices across our state and provide that advisory role for even across the country. I'm just excited that this is beginning to enter mainstream. I do think it's the powerful model that will bring us back to our roots as primary care physicians to practice medicine the way we were trained to do and do what we consider appropriate in terms of care and that relationship with our patients and being able to maintain that continuity. Those are the stories that are pushing this movement forward. And it's just exciting to see the growth that's occurred over these last 9 years.
One of the things I've also observed is even just the need to explain what DPC is, right? 2 or 3 years ago, people were like, what is that? Is that what, actually, what is it? What are you talking about? Now it's actually like, oh, that's interesting. I've heard about that. Tell me more. So I think we're kind of going through a different phase of growth in the movement where people are actually starting to understand it. And now it's more about how do we help accelerate that narrative and help bring people along without needing the hard part of kind of almost explaining what it is. And the problem with DPC is when you explain it, it's almost like too good to be true. So people are like, yeah, I mean, it can't, obviously that's not going to be the case, right? It's like too good to be true. So now that the narrative is out there, people are actually saying, hey, maybe this is real. Let's go find out more.
It's so true. You really hear it from both patients and physicians. I hear patients all the time, as I'm sure you do too, Janine, especially. Oh, I wish we could have access to our doctors. I wish medicine wouldn't be so unaffordable. I wish that, and then we, especially as a DPC doctor, I'm sure you did this too. We look and we're like, but that's what we're already doing. And physicians are sitting there, and that's why they're coming to ask DPC physicians like yourself who are wanting to find out if there's a different way to do it. And I love that people are asking about, is there a different way? Because even if they don't know that there's a problem, they're feeling it out as they do one more code in their clinic. So the other thing too, though, is that what I love about this movement right now and the time that we are in this movement is that not only are the stories continuing to explain, in relatable terms what we're doing, but now we have data to back up what we're doing. So the proof is in the pudding, not only through stories, but actual data. And Zach, at Hint, you have a unique role in understanding and visualizing that data. So can you speak to us today about the signs that you've seen over time? What data are you seeing that's pointing to greater adoption of DPC?
Yeah, for sure. I mean, one of the data points is that just the growth of actual DPC clinics, right? And so there's now over 3,500 DPCs. Directionally, we're seeing consistently greater than 20% a year growth in new DPC clinics. And that's been since we've been tracking, right? So for a number of years. And a few years ago, we conducted a research report. We're actually going to be refreshing that probably in the next 12 months or so. But there's over a 4-year period from 2018 to 2022. It's a little bit old, but I think the trend's still there, is that there's been an over 800% growth rate in the number of employers that are adopting DPC. So now there's, just on the Hint platform, more than 6,000 employers across all of the DPCs that are running on Hint. So that's just incredible. And we're also seeing kind of another really interesting data point that where practices are actually increasingly adding clinicians in second locations. We're actually going to drill in and try to get kind of more granular statistics on that. But there's a definite pattern there, which we're seeing that kind of success of that first clinic is precipitating in either adding doctors or clinicians into that clinic or just spinning up new ones in the town next door, things like that. So that's another pattern we're seeing, which is really compelling because it's lowering the friction for, let's say, not everyone wants to be an entrepreneur, right? Sometimes if you're a doctor, you just want to be a doctor. So the ability to go and come out of residency and go join a DPC clinic like that opens up another avenue for growth. And then perhaps the last thing, which I actually had to double take on this number, but just in the last 12 months alone, the growth in patient volume, again, this is hint data, not necessarily industry data, but there's been a 46% growth rate in total members, active members, right? And that includes churn across the hint database, which actually is really quite incredible. Like that's a lot, right? And that's a combination of new clinics as well as clinics adding doctors and then those doctors getting their panels filled, right? So you have that. So that's just some of the data, and then you could keep going on and on, but it's pretty good, right?
It's just incredible. It's one thing to be a DPC physician in the 30 minutes to 90-minute visit with your patient. And then it's really awesome to take a step back and see how DPC around us is growing, more physicians choosing to do this type of medicine because, like you said, Janine, it really speaks to how much people loved having the time to take care of their patients, that patients love not being rushed with their doctors, and the value of the relationship between the physician and their patient to be able to prevent illness and to be able to get accessible care when one needs to. So when we talk data, I want to ask you, Janine, from your perspective, can you speak to the data that's out there that you talk to others about, especially when other physicians are coming to you to learn about DPC, and how data in general can help make this movement stronger in going into the future?
Well, when I speak to other physicians, typically it's people who are interested. We speak with residents locally to get them exposed to the model of care. Some of them are in total disbelief at both the simplicity, like Zach had said, and how does this really work? We talk about things like reducing overall cost. I think the Millman study came out with 20% reduction in overall cost from the model. I think we've seen a variety of estimates of that being somewhere between 20 and 30%. We're now seeing the Millman group re-perform that study with sort of a broader base of physician practices in order to get even more detail as to how the model is saving expenses in the current healthcare system. The other things that we focus on with physicians is total patient load. We are not a model that sees 4,000 patients, which is what some of our local groups are actually forcing physicians into at this point, and it's really unmanageable. We have a smaller profile of the number of patients per physician, and that's much more manageable for each of the independent practices. And that's something that they can also negotiate in terms of work-life balance as to how much work is involved with the pool of patients that they have. I think there's often a lot of criticism in the model about not seeing enough patients, but I do think that part of the attraction to the model and the ability to actually maybe bring more physicians into primary care and DPC is to show a model that actually is a reasonable patient platform that is manageable, allows you to do the work that you are committed to doing. And so I think those are sort of the points that we emphasize with other physicians when we talk to them about how we're doing this and what we're doing. The other component that has been a little bit difficult to obtain from our perspective is what sort of metrics do you use to be able to gauge how you're doing relative to the model of care? And you'll hear a little bit more about how we're beginning to approach patient-centered metric to be able to evaluate what our practice is doing more from a patient's opinion approach rather than a strict metric approach, to be able to validate that we are doing good work and that we don't necessarily need to record every hemoglobin A1C in order to show that we are doing excellent work for a patient.
I'm sure that there's people in the audience who just shake their head at 4,000 people on a panel. That's more than 10 patients a day working 365 days a year. So forget vacation, forget spending time with your family. That's not important. You got to see over 10 patients 365 days a year. Does that sound palatable? No, not to patients, not to physicians. So it is so crazy that when a resident is going into choosing where they're going to practice, I'm very proud that residents are asking the question of like, how many people do you have on your panel? When we talk about metrics, it probably evokes some PTSD in people because people are so sick of how the way that metrics have been put into meaningless use data that is not helping our healthcare system. One of the things that you mentioned is really focusing on what actually matters. One example of how powerful patient-centered data is coming from the person-centered primary care measure from the Larry Green Center. And it's a great example. Dr. Ellison Edwards, a fellow DPC doctor, used that in her clinic, and other doctors like Dr. Ben Aiken, who was just previously on the podcast, use that as well. And it's a very different way of using study of your patients to help your practice and to help the movement rather than to generate codes. So I respect the PTSD feeling that somebody may have hearing metrics and codes in the same sentence, but they are not necessarily the same.
Just one thing I wanted to mention is your stat around your 365 days in a year, and so it's 10 patients a day. The way it stacks up is you actually probably have, I don't know, back of the envelope, 200 days a year, or the amount of actual functional working time there is. And so actually what it ends up being is actually 20 patients a day, which actually I could see a world where conceivably you could still have a 45-minute meeting with 10 patients, and that would be a pretty intense day. But what we're seeing is actually 20 to 30 visits a day in a traditional fee-for-service model. And to your point, Janine, the argument that, well, reducing the number of patients you see is actually going to hurt the primary care system, to me, that's a logical fallacy, right? The reason there's a shortage of physicians is because they're seeing 20 to 30 patients a day and are, not fulfilling the love of medicine and delivering the type of care they want to do. If we can fix that fundamental problem, right, actually make this the type of care that doctors want to go into, then it'll ultimately, over the long-term horizon, fix the fundamental problem.
So for those who are not familiar with the patient-centered primary care measure, what are examples of the questions that are involved in a type of study like that?
These are metrics that are centered around how the patient has experienced the practice. And so they're important for things like that my doctor cares for all factors that affect my health. The practice makes it easy for me to get care. My doctor and I have been through a lot together. The care that I get in this practice is informed by knowledge of my family and of my community, where these are much more relevant to how we should be functioning in primary care and helpful to the practice to know whether or not there are some issues in terms of, is there a communication area that we need to work on? Are we appropriately approaching our patients' healthcare goals? And I think we will get a lot of good information as direct primary care practices from this type of approach, that if we can come up with an easy method for direct primary care practices to be able to do this work, that we will be able to show some data about our quality and efficacy going forward.
One of the things, so we're going to be helping kind of get the word out across our ecosystem. And so we're targeting a fairly substantial number of clinics getting involved in this. We're actually planning to, at the HINT Summit, kind of present the sort of first, there's multiple phases, but it'll be results from the first phase. So that should be presented live at HINT Summit, which will be super exciting, by Janine and Amy.
What matters to our practices is making sure that our patients are valuing the service that we're delivering, making sure that we're delivering good evidence-based medicine, that patients have access, because our patients at the end of the day are investing in us. You made a very good point. It's a way for us to learn about how we're delivering the care. And it's a way for us, because we have the autonomy that we do in DPC, to be able to make changes that positively help our practices going forward. So Let me ask you, because of our experience in DC earlier this year, Janine, if you can recall any stories that speak to the answers to those patient-centered primary questions, how they impacted the people like who Zach saw, like leaning forward.
Using some of the stories from our patients about the continuity of care that we provide. We are a practice that still does our hospital work. So our patients who do wind up in a hospital setting are still seeing us, and we are providing their care through that silo of care, in a sense, that does occur in the fee-for-service world. Their gratitude over us providing the continuity has been just an amazing part of the relationship that we've been able to generate as physicians with our patients. That trust that allows us to prevent going into the emergency department in the middle of the night when we're able to talk to our patients and say, hey, we can do these things. Let's see you tomorrow. The increase in access that our model is able to perform, where we can see people right away and they're not waiting 3 months to see their primary care physician. These are some of the things that we talked about when we were on our trip to Washington, D.C., to help support the Direct Primary Care Coalition's work with the Medicaid Primary Care Improvement Act and the Primary Care Enhancement Acts that we've been trying to put forward for both better Medicaid access in innovation projects with the removal of the waiver that the innovation centers have been putting forward, and then also to help with defining the HSA issue that is present in the DPC model of care that we've been working on for a number of years.
I definitely would encourage people to read Dr. Garrison Bliss's article that he wrote for DPC News, where the group of people who were lobbying in DC, independent physicians sitting across the table from companies like Amazon and Boeing, listened to the coalition meeting that happened before we actually went and talked to staffers. It's quite interesting. And I think that this speaks to how impactful it can be when others get involved. So as more stakeholders in this movement get involved, patients, brokers, physicians, tech companies, people who are with solutions to help us deliver the care that we want to and that we can deliver through DPC, how can different stakeholders take an active role in continuing to help DPC go mainstream and get greater adoption nationwide?
Yeah, I mean, one of the things I think is really important, the power of story is really important, obviously, and I think tech companies and anyone out there, we can help share the stories of patients, physicians, and I think amplifying that message is really powerful. One of the things I think is actually quite important and maybe kind of under thought about, I guess, is getting, as an industry, consistent with how we communicate and the way we talk about DPC, and I think the consistency of the language, I think, actually is important. At Summit, Kenneth Hugh is going to be doing a talk specifically actually on this, around how can we help DPC go mainstream through like common language and certain kind of common threads in terms of stories. But diving in, and you mentioned tech vendors, obviously we partner with DPCs as a technology company. And one of the things that I think is really important, and I'd love to see more of, is often when tech vendors or vendors will kind of come to serve DPC, they'll often be in service of many different things, and then they'll also support DPC. The thing I'd love to see is groups coming and saying, hey, we're actually going to be, our primary focus is going to be DPC. I think the industry is getting to a scale where you actually build a business there now, right? So, and saying, hey, we actually we really understand the unique aspect of DPC. And that's something we've been doing since day one and is really passionate about. But I think the industry is growing such that actually more and more groups can do that.
I would agree with Zach that our language does need to be a little bit more cohesive in terms of how we describe ourselves and how we are coming together as a movement. I also would like to caution that we should always maintain that focus of the doctor-patient relationship. That's the critical component. And as long as we kind of keep that centered focus, what has happened in the fee-for-service world with outside interests really losing that focus, I think we will be able to hold it together and maintain the growth while we go forward in the direct primary care movement.
Another point I was going to make just is that for current DPC practices, one of the most powerful ways to spread the word is by kind of educating your peers and residents, right? And it's like it is a physician-driven movement, right? So continue that pressure, right? Continue that advocacy, because that's super powerful.
We've tried to maintain links locally in our residency programs. We have the local Natividad Center here in Monterey. We have a new residency coming up in Santa Cruz County. And we are a component of both groups in their practice management rotations. So we are there to help be accessible, help for them to see the model, get them to be exposed to it early. And I've had residents come back in their second and third years that are, well, how do we do this? How can we manage this? What's the best way of putting it together? So that I think is critical, because I do think it's our younger docs in this movement who are understanding what it is we're doing and are able to come out of residency with sort of a broad range of things in family medicine that they enjoy doing, that they're able to maintain in this model. That would include things like hospital work. So it is critical that we continue to expand the education, especially for the new docs that are coming out and early in their residencies, so that they see that this is a possibility and they're not just facing a employer contract with a large group coming out.
And one of the trends that I've thought is really interesting is, if you think about in the traditional fee-for-service model, on the one end of the spectrum, you've got a doctor, and the other end of the spectrum, you've got like a health plan and brokers, and it's just like total war, right? Between those two, it's like the totally opposite end of the spectrum. Incentives, the system is just like fundamentally broken, like we all know that, right? What is super interesting, if you think, on the one hand, we have this physician-driven movement, right? This like renegade group of doctors and clinicians that are going basically, hey, let's do something different. And now we're starting to see that go mainstream. What we're seeing on the other end of that spectrum is we're also starting to see a new type of advisor, right? A new type of broker and advisor who actually is railing against the system and on the other side of the system in a similar way to these doctors have, where they're saying, hang on, this is immoral, what our industry is doing. Let's figure out a different way to get really great access to care for the employees that we're serving. Let's actually figure out how can we save money while improving access. And what I think is really interesting is you're actually seeing almost like the connection of those two extremes coming together. We have actually a DPC doctor and an advisor that really truly cares, and they're trying to figure out how can we care for this population. And it's got to the point actually where we've seen some doctors become advisors, like actually get the brokerage and their licenses, so that they can actually play both those roles. But to me, that's this sort of almost like the third camp here that is really critical. And I really just implore you, as if you're a DPC clinician, go find whoever that advisor is in your community. And it's like DPC, it's a small community, but it's growing. Go find that person and figure out how to collaborate with them, because I think together there's a lot of magic can happen. We're going to be trying to facilitate some of that connectivity at the Hint Summit, right? Where we invite some advisors that are really mission aligned to come and collaborate and talk about how can we make this go mainstream together. But I think it's another really powerful underground movement that's happening on the other side of the fence there.
And this echoes what you guys have continued to mention, but our stories matter, words matter. We see in our DPCs, word of mouth is how we really, really grow. What is really the biggest ROI is a patient who is so amazed and impressed and thankful for your care. There's the current amount of brokers that understand DPC, there's other brokers that they talk to. And so this is definitely just calling out that word of mouth and sharing what you do with people matters. So with that, I want to get into the details now of Hint Summit. Hint Summit is going to be this September 27th through 28th in Denver. And again, the title of this year's Hint Summit is Elevating Healthcare, DPC's Climb to Mainstream. So Zach, can you tell us some more details?
Yeah, for sure. If you want like the nitty gritty, go to summit.hint.com. But I think maybe just talking high level, the intention of Summit has always been about inspiration and kind of how can we help inspire this community to go to the next level and help form connections, right? Now, we do have a bunch of content. We've got one of the things we try to do each year is bring keynotes in that maybe are a little bit off the beaten track, or things that you may not have heard about or thought about. And we try to delight there a little bit and sort of expand the mind. And so we've got some really interesting keynotes there on that front. We also bring topical topics in. So, for example, we've just spent time talking about regulatory stuff. We'll be having Jay Keith doing a talk on kind of update from the Hill and maybe live update on what's going on. Mentioned Kenneth is going to be talking about the power of words. We've got Neer Patel, he's a DPC. He's got a scaled out a handful of DPC clinics, but also has a broker group and advisory. So it's one of these examples of folks that have tried to bring these two worlds together. There'll be some really interesting stories there. We actually have our very own Dr. Brad, who's going to be doing a story with one of his employers, like a case study and live interview with one of the employers that he's working with to look after the employees. And there's going to be two tracks. One of the tracks is all around kind of building and scaling a successful DPC clinic. The other track is more about aspiration, like how can we help take this movement to the next level? So you can sort of network in the places you're interested in, and there's really good content for the stuff you're looking for. And there's like a ton of stuff we're going to do, great parties, events, things like that. The thing that I want to leave with is that at the end of the day, the content is going to be awesome. But the thing that I think people always go away with from Hint Summit is the connections they form, the friendships that they solidify, the inspiration they get from just being around other people that are like-minded. And I think at the end of the day, it's the intangible, I think, that is what is going to be most powerful.
We've really appreciated the networking, the joy in this movement coming together, and the environment that Hint provides with the summit. So actually this year, the fellow physician in my office, Dr. Adam Yarme, is going. So it'll be his first time to be at the summit. And we've just truly appreciated what Hint Health has been able to put together for our movement with these events.
So again, Hint Summit Elevating Healthcare DPC's Climb to Mainstream is happening September 27th through 28th in Denver, Colorado. The details are definitely going to be at summit.hint.com. Keep checking back there for the list of ever-growing amazing speakers. The cost to attend is $599 for the general public, $499 for Hint customers. And if you use the code MyDPCStory, all one word, you can get $50 off your ticket. If you are a resident or a medical student or somebody who is interested in attending and cost is an issue, please reach out to the team at summit.hint.com. There are scholarships for residents, and there are also DEI scholarships.
At the end of the day, we see Hint Summit as part of our kind of giving back, right? So it's a non-profit endeavor, right? We're trying to keep it as affordable as possible. And we always survey at the end of it, like, what do you guys think? What would you do differently? And the survey results are really good. 98% of people love it. This is an event we put on for the community. And yeah, we look forward to celebrating with you all.
One last time, summit.hint.com. If you would like to get your ticket to join the direct primary care enthusiasts, pioneers, and innovators, and to network with them and to share your story and to hear theirs. So thank you again so much, both of you, for joining us today.
Great to be here.
You're welcome. Thank you.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.